Joining us now in our newsroom, we have Dr. Brian Boyarsky from Johns Hopkins University. Welcome.
Thank you.
So, Dr. Boyarsky, I understand you have some really interesting new research regarding the COVID-19 vaccine and how it relates to transplant recipients. So tell me a little bit about this research. What did you find?
Yeah, well, thanks very much for the opportunity to speak with you.
Of course.
We are talking about our research findings in which we studied 658 transplant recipients from across the United States. So these are solid organ transplant recipients who underwent one of the mRNA vaccines, so either the Pfizer vaccine or the Moderna vaccine. And what we found was that after 2 doses of the vaccine, only 54% of patients in the study developed antibodies after vaccination. Now, this is in stark contrast to what we've seen in healthy people after just 1 dose of the vaccine, where 100% of healthy people with competent immune systems generally developed antibodies.
Oh, that's a drastic difference there. So are we talking about all types of transplant recipients? Are we talking about a certain type? And why do you suspect that this is happening?
So in our study, we included all different types of transplant recipients: kidney recipients, liver recipients, heart, lung, pancreas recipients. And I think this is happening for several reasons. Number one, there are a lot of medical conditions that transplant recipients have that may dampen their immune system. So for example, lung transplant recipients may have certain autoimmune conditions that could dampen their immune response to, say, a vaccine. But transplant recipients are also on strong anti-rejection or immunosuppressive medications, which in many ways dampen the immune system. So it's really a proof of concept in many ways, in that these immunosuppressive drugs or these anti-rejection medications are doing their job by slowing down the immune system. Now, the reason this is so important to study in transplant recipients is because in general, transplant recipients and other immunocompromised people, and there are about 10 million immunocompromised people across the United States, were excluded from the original vaccine trials. So though we know that the vaccines work great in healthy people, we just weren't quite sure how well they would work in immunocompromised people.
You're right. I mean, transplant recipients are just a portion of the population that are immunocompromised. And just out of curiosity, why do people get a transplant? Why are they on immunosuppressants? I think it would be like the opposite. I mean, just out of curiosity.
Yeah, so people in general after transplantation, the objective of the immunosuppressive drugs is to blunt the body's natural response, which would be to fight off a foreign organ. So we kind of attack the immune system in a couple of different ways to help blunt the immune system's ability to fight off that organ. Now, it always comes at a fine balance, because the more that you suppress the immune system, the more that you increase the likelihood of someone's ability to fight off an infection or fight off even cancer, for example.
Right. Wow. And I mean, it's interesting because, right, I mean, this new lung, let's say, it is introduced as sort of a foreign object in the body. Okay, so that makes a lot of sense. And what about, I mean, did you stratify on the length of time in which someone had the transplant? Was there a difference between, let's say, someone who got the vaccine, it was close to or close to their or short after their transplant, versus someone who maybe had one months later or a year later? Or did you study a specific population, like let's say 3 months out?
Interestingly, we studied people all across the spectrum. So some fresh transplant recipients transplanted, say, within the past 3 months or 3 months prior to vaccination, all the way up to 40 years after transplantation.
Oh.
And interestingly, what we found was that those who were further out from transplant, so 10, 20, 30 years out from transplant, were more likely to develop antibody response to vaccination. And that could be for several reasons. One, for example, the closer someone is to transplant, at the time of transplant, we give a heavy dose of immunosuppressive medication, so even higher than the maintenance doses that a lot of people are on. So it makes sense that the closer someone is to transplant, perhaps the immune system is not up to par when it comes to being able to, say, mount an antibody response to the vaccine. And the reason this is so important is because the reason our findings are so important are because the CDC has recommended a lot of relaxed social distancing guidelines and removal of masks when congregating with other vaccinated people and even unvaccinated people. But we categorically do not think that transplant recipients and certain other immunosuppressed people who are on similar types of medications should assume that they are immune to the virus after being vaccinated.
Oh, that's incredible. You're right. I mean, these CDC guidelines and again, the recipients or immunocompromised other populations weren't included in these trials. So great for healthy people, but we're just not sure yet in terms of, well, you of course, in your research are getting us one step closer to understanding this and what needs to happen. So maybe making these sweeping statements of what people can do isn't really the best thing.
Right. The other piece here is that the immune system is rather complex. And through our research study, we're looking at a small glimpse into the greater immune system's response to the vaccine. So there are other cells at work, for example, T cells and memory B cells that were not being studied through this particular research project. So it is possible that there are other players at work in the immune system to confer some level of protection. But I will say that we have seen a good number of infections or breakthrough infections of people who've been vaccinated, have not developed antibodies for protection, and then gone on to develop severe forms of the disease.
Wow. Wow. And you're right. There's sort of an army of well, I'm telling you, you're right. You know, you're right. Like, I mean, why am I saying that? It's so interesting because, right, that we antibodies, of course, we need to measure them, but we also can't forget that there's this whole army of cells that we can also measure. So I'm wondering if that's your next step in your research, or continuing on in terms of maybe having a larger sample of transplant recipients. And again, that is so interesting. 3 months out to 40 years. That's incredible.
Yeah, absolutely. There are many next steps. So some deeper immunophenotyping, as we call it. So looking at the T cell and memory B cell response to vaccination. But in addition, there are other things that can be done and studied in a controlled fashion. For example, perhaps modulating or changing or reducing the dose of immunosuppression at the time of vaccination, because we are finding that there are certain immunosuppressive drugs that are associated with a poor response to vaccine. But that's going to be something that will have to be done in a very controlled fashion, because as we spoke about earlier, these medications are very important to prevent rejection of the organ. So it would be unfair to just tell people to stop taking their
Yeah.
immunosuppressive medications just so that they can have a response to the vaccine. And a final step could be exploring an additional booster dose, for example, to help augment whatever small immune response might be there for some people.
Wow. I mean, right. I mean, fresh off of a transplant, there's so much going on. And I like how you mentioned that there's also other comorbidities a lot are associated with someone who has a transplant. That might not just be going, there might just be that going on. And just out of curiosity, are there specific comorbidities that go along with that? Or, I mean, do we see more hypertension? Do we see more cardiovascular disease, obesity maybe? Or, I mean, maybe all three among others?
Sure. I would say probably all three among others. High blood pressure, hypertension, diabetes, obesity are key risk factors for the general population for developing severe form of the disease. And we certainly see that in transplant recipients, in addition to certain autoimmune conditions that may have led to the organ failure to start out.
Yeah. Wow. That's incredible. So interesting research really needs to be taken into consideration for
Yeah,
public
and the
health.
the the additional recommendation we have, so many people ask us, since you're not seeing that great level of antibody response, is it even worth it to get vaccinated? We absolutely recommend vaccination for transplant recipients, because even though we're not able to necessarily detect an antibody response, as we talked about earlier, there could be other factors at play in the immune system. And in addition, what we recommend is that the social networks of transplant recipients, family members, loved ones, friends who may be congregating and seeing their transplant recipient loved ones or friends, absolutely should get vaccinated as well to confer at least some level of protection to their friends and loved ones.
Right. I mean, the in the beginning, I mean, of course, we wanted to keep our immunocompromised. Of course, transplant recipients were part of that group, protected and safe, and social distance, especially taking care of them. And then also, it seems like it should remain that way in a very strong sense. Um, wow. Anything else you'd like to add? This is so interesting and so fascinating, and such great work you guys are doing, and a really important question that needs to be addressed. Really, kind of, I would say, desperately.
Yeah, I would just like to thank all of the transplant recipients. There have been 4,000 transplant recipients who've enrolled in our study since early December, and it's a very motivated group. People are very worried about COVID-19 and its real potential to impact their lives. So I do think that, we need to very much consider that there are a lot of immunocompromised people across the country and the world, and we really need to think about how to best protect these vulnerable people, because not only is it the transplant recipients themselves that could suffer severe consequences of the disease, but if you think about it, if a transplant recipient or say another immunocompromised person doesn't have any protection from the vaccine and gets the virus, it's been shown with other viruses out there that these people could harbor a resistant strain of the virus, which could then confer the vaccine unlikely to work for everyone else. So it's very important to try and figure out this conundrum right now.
Yeah, yeah. People are so brave and willing, it seems, to be a part of science, which is a great thing. Dr. Boyarsky, thank you so much. It was such a pleasure to have you with us today. I really appreciate it.